Yo, it is 2024, and today we have to talk about what many health experts are saying is an outbreak of measles, and people accusing Florida's Surgeon General of endangering children. Right, and this is new health data shows that as of yesterday, 2 more measles cases have been reported among children in Florida, bringing the total number to 8, and all of those coming from Broward County. And here's the thing, 8 sounds and is a very small number. But given the specific context of the situation, you have people saying this is still incredibly concerning. And that in part because measles is one of the single most infectious diseases in the world. So much so that according to the CDC, for every 10 unvaccinated people who come in contact with it, 9 of them will become infected. And that's horrifying because it can have some very serious health complications, especially in children younger than 5. And this is nearly 1 out of every 5 people in America who contract the disease, they get hospitalized. And the death rate of people with measles is around 1 to 3 out of every 1,000. Now the good news here is that the measles vaccine has existed for a long time. It is highly effective. It makes it a very preventable disease. But the bad news is not everyone takes this threat seriously. And currently we're seeing cases and deaths surging globally, partially because of growing vaccine hesitancy after the pandemic. And in Florida specifically, you have people pointing to Florida Surgeon General Dr. Joseph Ladapo, with many saying that he's played a big role in building that hesitancy, with him receiving widespread criticism for embracing anti-vax talking points, at times spreading misleading or outright false claims about the effectiveness and safety of vaccines. And he's been widely condemned for promoting policies that go against common sense public health guidance. And most recently, he wrote a letter last week after 6 measles cases were all reported at Manatee Bay Elementary School near Fort Lauderdale. And there, not only did he defy federal guidelines by refusing to encourage parents to get their kids vaccinated, which is the best way to prevent spread and serious illness here, he directly went against CDC guidelines meant to protect kids who are not vaccinated against measles, telling their parents it's okay to send them to school. Because following widely accepted medical science, the CDC recommends that unvaxxed kids who have not previously had measles be kept in isolation for 21 days after exposure at school. And while Ladapo acknowledges this, in his letter, he also wrote that instead of recommending that guidance, he would just leave it up to parents to decide if they want to send their unvaxxed kids to school during a measles outbreak. So unsurprisingly, you had a ton of top public health experts condemning the move, with some explicitly accusing Ladapo of endangering children. With Paul Offit, a pediatric infectious diseases expert at Children's Hospital of Philadelphia, saying, "This is a state surgeon general saying he is not going to enforce any of the tenets of public health in the name of freedom. He wants freedom at the expense of putting children in harm's way." And that was also echoed by the American Academy of Pediatrics Florida vice president, who said that allowing unvaxxed kids to attend school during an outbreak not only endangers those kids, but also risks further spread, explaining when you have an outbreak, to contain it, you have to follow the public health and safety recommendations, not give people a choice. Frankly, giving people a choice is what got us here. Now with this, I do want to note it is unclear if the 2 cases identified since Ladapo's letter are connected to the Manatee Bay Elementary outbreak, with a spokesperson telling USA Today that the district hasn't determined any new cases since then, but the fact that both new cases are also in Broward is significant. What's more, it's also been reported that one of those 2 cases was the first in a child under 5, which is notable because experts have said that this is early days, saying that this outbreak is expected to spread beyond school-age kids as others bring it home to younger siblings. But for now, we're gonna have to wait to see how this develops, especially because with measles, it usually takes like 7 to 14 days for symptoms to develop. So in about 2 weeks, we'll have a much bigger idea about what the actual scale is here. Obviously, this news is both Florida specific and then kind of more grand and global.